Thank you all for joining us today. We're here to talk about a really important issue affecting Oklahoma students, and that's food insecurity and hunger. My name is Ryan Walters, and I'm the Executive Director at Every Kid Counts Oklahoma. I also serve as the Secretary of Education here in the state of Oklahoma. When we take a look at issues facing our students, we see several organizations that are really out front leading on the issue about health and assistance programs to ensure that our children aren't going hungry, and to discuss, and we wanted to bring them on to discuss the effects of child hunger on our education system and on our individual students. And so we really wanted to have a robust discussion today about what are programs that are in place and what are the issues facing our young people here in the state when it comes to childhood hunger. So I'm very excited to have Stacy Dykstra, the CEO of the Regional Food Bank of Oklahoma, Chris Bernard, the Executive Director of Hunger Free Oklahoma, and Julie Bisbee, the Executive Director of TSET, the Tobacco Endowment Settlement Trust. Three great organizations that are doing a lot here to help our students. So just as we're getting started here, I wanted to provide a quick overview of why we are here this afternoon. As the Executive Director of Every Kid Counts Oklahoma, we believe that it's very important that every student has the opportunity to learn and succeed. It is equally as important to understand the challenges and barriers that some students face and hinder their education so that we can provide solutions for them. We know that 1 in 7 U.S. children deal with hunger and food insecurity in Oklahoma. We know that 1 in 7 children deal with food and insecurity in the United States, but even worse in Oklahoma, it's 1 in every 5 children deal with hunger and food insecurity. As an educator, I've seen children struggle because they didn't have enough food at home. And again, for a student to be able to focus in class when they don't have proper nutrition and are worried about where their next meal comes, it's incredibly difficult for that student to be successful academically, which then puts them way behind in life and being successful and being happy. So really what we wanted to do is with the panel today, discuss how this issue is affecting our students, but also let some experts here provide insight into what are some of the programming that's going on across the state to help solve this issue. And so, without further ado, I'm going to go ahead and start turning this over to our panel of experts here. And I wanted to ask, we'll go ahead and start with Stacy. Stacy, could you help us understand what food insecurity means and what the Regional Food Bank was doing before the pandemic to get food to kids, and what's changed since the pandemic has began?
Yeah, thanks, Ryan, and thanks for teeing it up. You pretty much covered exactly, why this is so important for us. So a term used by the USDA is food insecurity, and it just means that an individual does not have consistent access to nutritious food. And, for us, that is, of course, very concerning because when children are food insecure, it directly impacts their development, their cognitive, emotional, and physical development. And, not only how they perform today, but how they'll perform as, productive community partners as they grow up and join the workforce. At the Regional Food Bank, we do have 4 targeted sources to address childhood hunger, and we call them our Food for Kids programs. We have a backpack program that we do in elementary schools. We send food home on weekends to children. We have a school pantry program in middle schools and high schools. We have kids cafes, which are after school programming where we help with the food. And we also have a summer feeding program that feeds children all the way up to 18 that need to access that food during the summer. And so all of those programs were in place long before the pandemic and continue to be in place. And what we did is we just worked really closely with all of those partners to identify, were they still feeding children the same way? Did we need to change things? So it wasn't really about new programming, but it was about making the most of the programming we have. And I would say being new to the Regional Food Bank, it's one of the things I'm most proud of is that system, that network that we have that is so far reaching within those 53 counties that we serve. Almost 700 partners serve food to children through our 53 county service area. So we got real creative on how we made sure children could access food. And I know you all probably heard of even, partnering with school districts and putting food on buses and driving the bus routes so that children could just be at their bus stop and receive their food, but all sorts of ways. I mean, we've delivered, pallets of those backpack sets of food for then schools to put together and get out to children. So we're doing everything we can to just make sure children have access to food.
Wow, you addressed several of the items that I want to continue to unpack here, Stacy. Thanks for sharing some of that work there that you all are doing. And again, you see the broad reach of your organization and all the work being done there. Julie, let me ask you, could you tell me a little bit about how this issue came to the attention of TSET? And we unpack for some of the work that you all have been doing there on helping bring food to kids?
Sure. TSET has been working in preventing and reducing obesity since about, 2010. And looking at the relationship between hunger, food availability, and obesity was really how we started thinking about this issue. And as the pandemic was unfolding in March and you were seeing schools, really the hub of the community for child well-being being shut down for safety, we were thinking, how can we continue to promote good health and access to healthy foods for our youngest Oklahomans? And how can we continue to help them be on a path to becoming healthy adults? We have incentive grants for schools, and one of the things that we look at there is, is there availability of fresh fruits and vegetables? And our teachers, supporting that, hey, try a strawberry today, try some broccoli tomorrow. So that was already part of what we were doing. But as we saw, early data show that the pandemic was going to heighten food insecurity and that it was going to be even more serious for children, we really started looking, who are the partners across the state that are already doing this, and can we help them leverage that effort? And so our board of directors approved about $1 million to be used as a one-time grant. And we had everyone come and bring a competitive proposal. How will you address food insecurity, but also in line with our mission, how will you improve access to healthy foods and fresh fruits and vegetables? There is a correlation between food insecurity and obesity. And so for us, it was, can we keep children on a path of fresh fruits and vegetables? Can we continue to help make those things out there and affordable? That often is the challenge. And so we have 7 grants that range from assisting with Meals on Wheels in Western Oklahoma, helping to support Hunger Free Oklahoma's effort to increase buying power for fruits and vegetables in grocery stores, which I'm sure Chris will touch on. Also helping in rural areas, helping the community come around their producers. You have a lot of folks who work in ag, have gardens, and we were seeing as the pandemic was shutting down that restaurant supply chain, that there was a dearth of fruits and vegetables available. And so we worked in Laverne in Harper County to help their Chamber of Commerce come up with a branding for their local producers, and they now have kind of a storefront farmers market. So there's a lot of ways that we wanted to see what was out there and how we could support it in line with our mission always. And we have Shape Your Future, which is Eat Better, Move More, and Be Tobacco Free. And so this was just an extension of that.
I love both of you talking about tapping into the resources and and you just see you working with all these other organizations, and it really does. You do a great job of leveraging all of the human capital and resources to get those to students. I appreciate you guys sharing us some details about that. I want to kick it over to Chris here for a second. So Chris, can you tell us a little bit about, there was a recent report showing that childhood hunger is spiking across the country because of the economic crisis that the pandemic caused. This can be, parents losing employment, kids are out of school, and the schools are so often a place for students to get food. We've also seen, that brought more pressure upon the food pantries and emergency services, some of these different entities that we just mentioned here. And so we know that Oklahoma, I mentioned this earlier, that 1 in 5 children across the state deal with some food insecurity and hunger issue. Mm-hmm. So could you kind of talk us through how Hunger Free Oklahoma is working with communities to address kind of all of these issues, even brought up even more severely because of the pandemic?
Sure. So I like to think of our work kind of in three buckets. So we start really at trying to make sure the resources are available. For us, that's primarily around federal nutrition programs. So that means the second it was clear that this was going to be a serious issue, we were talking to our federal delegation about flexibilities that needed to happen in programs or additional resources. We were talking to the USDA about when those would come down. The next step is really implementation of those programs at the state level. So that's working with our state partners, Oklahoma Department of Human Services, who frankly, during this whole thing has just done amazing work, as well as the State Department of Ed, who took advantage of every waiver they could to provide flexibilities to school and the food banks to make sure food was getting to kids in whatever way possible, right? We didn't want the normal regulations where a kid had to sit there and eat, because that made no sense for a pandemic. And then our third role is really, how do we go into communities and help them access those resources and leverage what they already have going on? So we go into communities and we'll talk to school districts and help them figure out the best model to distribute those meals. Some of them had never been summer meal sponsors before, which was the program that allowed the schools to feed kids through these grab and go models. So we walked them through the application process. We worked with State Department of Ed to figure out how to prioritize which programs and how to bring new ones. And then we assess gaps. So in addition to really trying to figure out how can we make it as easy as possible for our partners to get food to kids, where did we see either progress was happening too slow and creating a gap, or there just wasn't a program? So in the middle of the pandemic, we launched two brand new programs, one being Tulsa Kitchens Unite for the Tulsa community, because we saw our restaurants struggling. So we went to some funders and partnered with our food bank here, the Community Food Bank of Eastern Oklahoma, and we worked with 21 restaurants to produce over 400,000 meals that we then gave to our partners to hand to families. So schools used it to feed parents because they weren't allowed to. Catholic Charities used it to help feed folks they were serving and really bring an additional resource. At the same time, we knew our partners at DHS were overwhelmed from people losing their jobs, losing income, and needing access to SNAP, which is our biggest food insecurity program in the country. It brings over $1 billion back to Oklahoma every year to help feed our folks. And we saw them overwhelmed, so we launched a hotline to help people enroll in SNAP. So for those cases, we could really start to ease a burden on DHS and let them focus on the other work they were trying to do, and we could help folks access the program. From that, the last thing we really did is what Julie mentioned, right? So we run a program that doubles your SNAP dollars if you buy fresh produce. It's called Double Up Oklahoma. Traditionally, it had only operated in farmers markets, but we wanted to scale it and really see it reach communities. So we're bringing it into grocery stores, and thanks to the support of TSET, Blue Cross Blue Shield, and a federal match grant, we right now have that in grocery stores in Okemah and Jay, and are looking to put it into other rural grocery stores to start. We're seeing amazing uptake of the program, more than 3 times the national average people utilizing the program. In Okemah, it's changed the way the grocery store orders produce. It's increased their produce 50%. They can bring more variety to folks. And really, with those 3, what we bring is what's not happening, and everything else we try and do is how do we support and make more impactful the work our partners are doing, whether it's regional food banks, school districts, or others.
You know, I mean, listening to you 3, when you talk about the work of the Regional Food Bank of Oklahoma, Hunger Free Oklahoma, and TSET, you know, as a teacher, you know, I look at that and I think about, you know, you've got young students that when they're hungry, trying to teach them, you know, to learn to read, you know, by 3rd grade, and we're talking through math. I mean, if you're 8 years old and you don't have proper nutrition, or you don't even have a meal, trying to, as a teacher, to get that student to be able to learn these concepts. I mean, and you guys know, and then, you know, the other thing about that, especially with young kids, is that manifests itself in behavior problems. I mean, you're hungry, you're in school, you're being asked to do this and that. You've got the headache that comes with prolonged hunger. And, it's just, as a teacher, my heart just breaks for these kids, because then the academics fall, then they get in trouble at school. And you see that's a quick road to not being successful in school. And then you even talk about, and I'm a high school teacher, but it's the same thing for older kids as well, that when you're trying to teach these difficult concepts, and if kids aren't eating and don't have access to food, again, we are putting them in a situation where they're not going to be able to be successful. And then we're going to be having to try to address problems that could be prevented, or with proper nutrition, with this. And I found it very interesting, because I think you all hit the nail on the head about, utilizing the resources, utilizing the networks, but also being aware of the gaps that could occur. I mean, I appreciate you mentioning that, Chris, because, we do have tremendous programs, and it's great to hear you all talk about the active mindset of, look, we want to ensure there's not people that aren't eligible here or that are being missed here, that we can circle up. So I think that's a fantastic point, and I love to hear the work you all are doing in that. Let me ask a question for Stacy and Chris here about, you mentioned working with the schools, and again, I'm talking about kind of how the schools fit into all of this as well. Could you guys talk a little bit about how did your services and partnerships with local schools change during the pandemic? Were there new programs created? Do you think that these will continue? Are they going to kind of change now as schools are back in session, and we're starting to see a return to normalcy in some capacity? Could you guys kind of elaborate on that?
Stacy, you want to go first?
Well, I was thinking you shared some really good new stuff that was going on, so I didn't know if you wanted to elaborate on that first.
Sure.
Okay.
So really, if I'm looking at new programs that launch in the middle of this, it's flexibilities to schools, things that actually advocates had been calling for a while, and actually Senator Langford even have been calling for a while, allowing flexibilities so parents could get meals for kids without the kid having to sit there, basically making access easier and thinking about not one size fits all for every community, right? There was also Pandemic EBT, which is just an amazing program that really gave parents buying power for all those free and reduced meals that kids missed. And I don't think we've actually said the number yet. It's over 400,000 kids in Oklahoma who rely on free and reduced lunch, right? And not every kid that actually needs it is accessing that. So the number is actually probably higher. And that program alone, just for the I'm going to mess my years up, 2019, 2020 school year, yes, brought in over $100 million to support families with kids getting food. That program is going to come again to cover this school year. DHS and OSDE have been working really hard together to figure that out and submit a plan. And you're talking about hundreds of millions of dollars coming back to support our families. That's a model that should run during the summer. And Chickasaw Nation has run a model like that in the summer. And it could be amazing to make sure families have easy access in rural and urban environments where they don't have transportation to get to the school in that 1 hour that the school's open to feed kids during the summer. And we hope that'll stay. All of these programs, all those flexibilities you heard me talk about, they are debated right now in DC because it's time for child nutrition reauthorization. All these programs are up for debate, and it's really the time to talk to our decision makers about why they're so important. Other than that, I would say what I think will really happen from this is you're going to see more, or what we hope happens is more community awareness of how to partner with schools to help support these programs. It is hard to for a school to support a summer meals program in a small community and not lose money on it. It's one of the reasons the regional food bank is so important, right? They can come in and help with that at times. But you also want community partners there to help support it. And I think where we can, we're trying to do that work through Hunger-Free Communities work, connecting everyone who cares about the issue and really saying, how do you create a long-term plan?
Yeah, Chris, I appreciate that. And I would echo that. And we're just so grateful actually for both Julie and Chris, because it just, as you so well said, Ryan, this is a group effort. I mean, this is too big for anybody to do on their own. And it takes all of us working together. And it's a public-private partnership, right? I mean, we are critically dependent on, like Chris said, SNAP, but also these waivers. They have changed the ball game for us. I don't know what we would be doing without some of those barriers removed to ensure that food's getting to children, especially in our rural areas. So I appreciate so much that you're saying that, Chris. And I think for us, what we're really excited about the partners we've added. So again, it's not about really new programming, but it's about really just trying to think about how we shift and pivot and stay flexible so that as our partners come to us and say, we're having trouble with this or we need this, we can quickly get what is needed. We have several new partners, but the community hope centers that DHS has helped launch with CARES Act funding, which are such an exciting addition to our state. We've been helping feed the children that are attending those programs as well. So I really don't want to waste any more time reiterating kind of what Chris said, but just if there's a message, it's that working together, we can address this issue and make sure all of our children are fed. And it is just too important to their success now and their potential to make sure they're well nourished.
And I just want to add, the waivers we're talking about right now are cleared through June of 2022. But after that, if action's not taken, we have to go back to a much more constrained model that is going to hurt access. And the last thing I'd add is you not only need everyone working together, you need every tool in the toolbox, right? So it's not one size fits all. There's another great program that came out of this. There was a pilot that USDA expanded nationwide called Meals to You, where kids in highly rural areas where they really couldn't get access and the school district didn't have the resources, they got a week's worth of meals mailed to them every week for, I think, 3 months, which was just an amazing impact for those families as well. So really, as much as we can, make a variety of programs available so different communities can figure out what works for them.
I think that is really good information. When we talk through, you've got these programs, you've got a pandemic, which puts people in more of a disadvantage to secure food. And then to your point, you see these waivers come that allow you all to easier provide food for students across the state. And I think it's a great time, when we look at this kind of in the education space too, is, we've issued certain waivers and then we look around and go, maybe these restrictions don't need to be here, period, right? Maybe these haven't. It's a great time to have the conversation about whatever reason or intention that these restrictions were in place. Are they accomplishing what the intent was, or are these just barriers that are not assisting our students in the way that we would want them to? So I think that's a great point. There have been certain ones, that as I've kind of encountered that, I think you could definitely take another look at it and go, now, why does it have to be that? Why does the kid have to be on site to eat the food? They can't take. There's certain things that you just think through and go, there's probably another way to accomplish what you're wanting, but ensuring that students will have the access to the food, which is what these programs are designed for, and it's what the state and federal dollars were designed to do. Julie, let me ask you, as we're talking through this, and we're talking about, Oklahoma specifically, could you give us maybe some context at where Oklahoma stands in comparison to other states when we're talking about food insecurity for our young people?
Sure. So we are the 5th hungriest state in the nation, and for fruit and vegetable consumption among adults, we're probably one of the worst. And we know through research and what we follow with our programs that those healthy habits, that having a fruit or vegetable a couple times a day, that's something that children learn. And children are very receptive. They're interested in experimenting, and it is ensuring that they have that access so that as adults, they are aware and have made healthy choices so that they can continue to do that. Our childhood obesity rate does outpace other states. And when we have seen the childhood obesity rate go down in our youngest kids, it's because there's been improvement in federal nutrition assistance. I think you take the stress off of parents a little bit. Parents want to do right by their children. They want to nourish them. And it is, how can we be a part of that solution? So in Oklahoma, you've got a lot of willing partners. You do have rural, and that is a tough thing for schools, for broadband access, for food access. We're looking to make change in communities where sometimes, a convenience store is the major place to get food. Through some of our community-based grants, we've found that those local owners want to be a part of the solution. So maybe they add refrigeration and add, milk, bread, eggs, and bananas. And there is an ongoing conversation in our state, and people want to feed their neighbors. They want to do that. That's very much in line with how we are as Oklahomans. And there's a need for it because we see that play out in adult health outcomes later in life, where there are high-risk behaviors that people adopt through coping or, high calorie dense foods, tobacco use to blunt the hunger. We're trying to prevent all of those things. And so I think this conversation is really vital in saying, what do we want that next generation to look like?
And I would love Chris and Stacy, if you want to jump in on that too. When we look at Oklahoma as a state, compared to other states, it's one of those things for me, and I know, but we're talking about statewide networks. You're looking across the state and you just see, the issues facing, folks. There are commonalities, of course, but then there's different issues that are unique to different communities on access to, again, you might have some access to food, but maybe it's not your best nutritious options, or maybe that you have issues of infrastructure in certain areas across the state that, again, I think Julie makes a great point there. You talk to Oklahomans, we want to take care of our neighbors. I mean, I love the Oklahoman spirit there when it comes to that. But you see, depending on where you are in the state, those issues can look very different. And we have these issues, whether it's Oklahoma City or even Tulsa. I mean, we talk a lot about rural areas, but you also have these communities that are here throughout even kind of our larger cities as well. So I would love if Chris and Stacy, if you wanted to comment on the broader kind of comparison, but also what unique challenges we have just around the state at fixing these issues when it comes to food insecurity.
Ryan, this is Stacy. I might jump in and just say, and maybe I can just set up Chris for what he wants to say. But I think when I hear us all talking together and just think about this, ironically, we rank pretty poorly in education and in health, and we're the fifth hungriest state. And until we really start addressing these things in tandem, I'm just, we're always not going to quite reach where we're all working so hard to get to. Hunger is the fuel, right? Food is fuel for our body. We can't be healthy and we can't reach our potential educationally without being well fed. And so I think just we have to think broader about how this all interrelates. And when we're working on one of the issues, we really should be working on all of it together.
Yeah, I think that's well said. My background's not actually in hunger. This is my first hunger job. I love my job, but I got into it because it's a foundational issue, right? I had worked on deeper systems, criminal justice, juvenile justice, all this stuff. And really, if you care about workforce development, if you care about health outcomes, if you care about education, if you care about the school to prison pipeline, like any of these issues, you need to care about and address food insecurity. And the unique problems, urban and rural, they are different, but at the same time, it's the same problem. It's just in a different setting. It's mobility, right? Ability to travel to where the resource is in a safe manner. It's a lack of your general resources, which is why programs like SNAP and WIC are so important for families. And then it's a matter of general sort of not just lack of food resources, but other resources, right? So food is the resource most easy to give up. You got to pay your rent. You got to keep your lights on. If you can skip a meal, you're going to skip a meal, right? And so we have to recognize that and try and figure out in what works in what community. And it might be a food pantry paired with healthy food financing grants that are coming out of ag, so the corner store has fruits and vegetables, and we can bring our double up program in there if we have the funding, right? So you're incentivizing the individual who's purchasing to buy that food, you're incentivizing the store to carry it, and you're making the community healthier. But I do think, I'll say what we're really excited about is we recently got a grant to do a collaborative blueprint to end hunger in the state. So we'll be bringing our partners like the regional food banks, who are really and the community food bank, who will be our primary partners, state agencies, local districts, all these groups, to really say, how do we all work together in any community to solve it?
You know, there are two things you said there that really, I think, were both of you, that really stick with me. The first is how interrelated all of this is and how foundational it is. You know, when I talk, with students, one of the things that you always hear is, there's these moments, these kind of like touch points that can really send, their academic future in another direction, and I'm amazed how many people, we all have our stories in school, right? We all can talk about the teachers that made a difference. We can all talk about, maybe a frustration or whatnot, but when kids get, and now you guys are allowing me to kind of this better lens of even taking a further step back. Kid goes to school hungry. Kid is in a frustrated mood. Kid has got concerns outside of school. They walk in, they get in trouble in class. And just to walk through how quickly that can go south, they get in trouble all the time. Now they don't want to go to school. Why? Because school's where I get in trouble. Yet all of a sudden you have this negative relationship with school. Teachers have a really hard time trying to overcome that. It's this constant struggle. The kid gets more and more frustrated. And before you know it, the student is getting older and they don't want to go to school. They want to drop out. And you look at what, again, to Chris's point, if you don't finish high school, the chances of you being able to get a job that you like, that you enjoy, the chances of you being able to have a family, the chances of you, and you even look at even the more dire statistics of being incarcerated and even an early death, and you can see how much of that can stem from if the foundation isn't set. That just stood out to me when you were mentioning this is just a foundational issue, that how quickly we have someone, and we all care about all of those issues that I just discussed, but if we can make a serious impact at the foundational level, what all areas of young people's lives this can touch. And so along those lines, I would love to hear you all, if we could unpack that a little bit. And again, this is just for anyone who wants to answer. When we talk about what are the long-term effects, I kind of walk through, a day for a student and kind of how that could have such a detrimental impact on the student's academic career and beyond. But could you maybe even talk a little bit about the long-term effects of food insecurity? Because we're talking about students, and as they leave school and have their own families, what are some of the issues that we see arise from this? Again, you mentioned earlier, Julie, about us being the fifth hungriest state. I mean, what are the long-term impacts as we talk about that many students that are perpetually hungry and aren't being served? What are some of those effects that we see?
Well, so I'll start at the top at our adult health outcomes. I mean, prevention is an economic development issue, and that's what TSET does, but that's what everyone else on this panel is talking about, is how can we create that foundation that's stable so families can grow, parents can nurture their children. We rank really high in diabetes, cancer, heart disease, and those are all things that steal people from us too soon and steal their productivity years, limit their ability to make money and be part of society. And so it is really looking, how can you get further and further back? I mean, I think all of us, knowing just the background of everybody on this panel, we got into this because we care about kids and we didn't like what was happening to kids. And we just keep moving further and further down the system to say, where can I impact that path at the most impactful point? Why am I talking about, adults and trying to change their behavior? If I could teach a child, like, you do need to have water every day. You do need to have fruits and vegetables every day, and it's available to them. And I think what the pandemic really showed us and emphasized for those of us that are not in education is how important the school is in stabilizing that day for the family and the child. If mom and dad know that that child is getting a good snack, a good meal, and maybe something to bring home over the weekend, they can start dealing with some of those other things. And so this is something that if we're going to change our educational attainment, our incarceration rate, our cancer rates, our diabetes rates, our smoking rate, we have to talk about what is happening in those early formative years.
Julie, that was awesome. And I just might add that I think it's so funny. I think in a lot of ways in our society, we think when kiddos graduate from high school, then they're adults and kind of, the work is done and then they kind of have their path. But, we've started partnering with colleges and VOTEX because they need pantries too. And we had one university president ask his faculty if I could do one thing, like if we could get one resource to our students, what would it be to try to move the needle, to make us more successful as a university? And overwhelmingly, the faculty said food. So if we have children who are struggling to get access to healthy food through the first 18 years of their life, it doesn't automatically go away when they graduate from high school or if they've dropped out of high school. So just keeping in mind that, it's an issue that follows people, sadly. And again, if you are not reaching your potential, when you get that first job, you're probably going to be overlooked for to get a raise or to get, a different job. So it's so important that children are well nourished and have that strong foundation for the future.
Yeah, I would echo what both of y'all said. And I think about two things in particular when I'm thinking about kind of this big picture. So one is we did a study with Chan Hellman from OU. We were looking at feeding every kid in the school for free, which some of our school districts do via a tool called the Community Eligibility Provision. And we were just sitting around having a discussion about the evaluation, and Chan proceeded to talk to me. He studies hope, right? So food directly impacts a kid's glucose levels. And I am going to butcher this scientifically, but this is the point, right? So glucose levels lead to certain chemicals in the brain and balance out that you absolutely need and lead to the feeling of hope. So quite literally, by feeding kids, you are feeding them hope. And hope is essential to being successful and seeing what's in front of you and planning for that. The other is that I think has been hammered home for me even more during the pandemic, because we're one of those COVID baby families. So we had our third child just 3 months ago. And even with just two, the stressors of day-to-day life in normal times, let alone a pandemic, I was not always the most supportive in helping my kids do their homework, right? I would get frustrated, and my wife and I have the resources and the support network we need to meet most of that. Imagine a parent who's potentially had their hours cut, who's not eating themselves, so they're grumpy, and trying to support a kid learning virtually. That is a challenging environment. And if we can provide a food resource that allows them for one day just to say, I'm going to think about helping them with homework, or I'm going to think about enrolling in that workforce program, which if they're on SNAP, the federal government will pay for half of that workforce program. Like, that's an amazing opportunity. And we need to recognize that all those things are linked. So it takes making all those connections.
I love the connection back to hope. I mean, it's a great point about, how much, hope is a student going to feel or be able to feel if there's so much concern wrapped around. And again, I'm not going to try to get into the science, but I know you're right. I mean, the connections there between, if you're not getting the proper amounts of nutrition, of those different ingredients there, that you're just not going to be able to. And you just start, again, like you said earlier, Julie, we all got into this because, we have a heart for helping out Oklahomans, and especially we're talking about young people here, and you just think about a child that's not able to have those broader aspirations because of the lack of nutrition across the state, and how heartbreaking of a scenario that is for our young people. That's a great connection there to the hope factor as well. Again, just anybody, as we're talking through this, any of the panelists here, and we've got schools opening up. We have schools looking at summer school options. There was a big announcement recently about this expansion of summer school options for students. We've been working with school leaders across the state. Excited to hear a lot of the ideas and a lot of the ways that they're going to reach students over the summer. I would just love to hear. I know it's hard to predict, but I would love to hear what you guys are thinking in regards to with these type of changes, with students back in school, with more robust summer school options. Do you have any predictions on food insecurity for our children over the next few years? Is there any other kind of factors at play here that make you either more optimistic, more pessimistic, or something? I would just love to hear what you guys see for the next few years for Oklahoma.
Well, I think we've brought together a lot of folks to talk about this issue, which is huge. And I think that even the most comfortable family has started to see how health impacts their overall ability to navigate their stress, right? We were all locked in a house with iPads and kids and jobs, and the duties didn't stop. To understand what that means to be low resourced and to have empathy. And I'm really excited about some of the things that these partners are doing, the Boys and Girls Club are doing. I mean, this has brought the issue to the forefront, and it's gotten on the radars in a way that I think is very hopeful.
I'll go next. So I will preface this with, I'm often accused of being pessimistic, but so here's what we know. Folks who are already resource deprived, when something like a pandemic hits or any economic crisis, it takes them longer to recover. They're hit harder. We have seen a ton of resources come in to try and prevent that from happening, whether you want to talk about unemployment, stimulus checks, but in food security, we've seen a ton. So you've heard me talk about most of them. We also had anyone on SNAP over the last 10 months has gotten emergency allotments where they go to the maximum benefit. That brought every month an additional $30 million in to support folks who are food insecure. That ends with when our emergency declaration was ended. So that'll happen through June, and then that resource will go away. And then, like I said, we have the waivers till June 22nd of 2022. And if that resource goes away, pandemic EBT if we don't renew it. So I'm hopeful because people saw the value. And I think these programs now have a different reputation. In Oklahoma, we had this tradition of treating federal programs like they were bad. And the reality is they're programs we've paid for. We can have the debate about not wanting them, but as long as they exist, we should be drawing the resources in because it's our money. We're a donor state. Our money goes to other states right now. We should be bringing it back to support our folks. And I think this crisis really made that a more popular opinion. And so I'm hopeful in that, like Julie said, a ton of us have come together. Public-private partnerships are at a level that we have never seen before. I mean, we've formed 3 new ones with state agencies, tons of partners have. And new partners have figured out how to leverage the resources. But it's going to take a lot of work to keep that going as the pandemic resources go away and we're dealing with a more stable time. Stacy, positive now.
Yeah, I know. I was thinking, So thank you, Chris, for making sure we're all clear that we are concerned about the long-term effects. It's just sort of the fear of the unknown and just knowing that we have a great need and that we do need all of the resources we can get to meet that need. And it's just why the conversation today is so important. So I guess I want to say first, thank you so much for just allowing the conversation to happen and hopefully to pique other people's interest in wanting to be part of the solution. But, I just might end by just saying families are faced with really hard decisions because of scarce resources. And the last decision we want any family to have to make is whether they're going to feed their children. So, I think just remembering that in all of this, when we're making decisions about, making waivers, permanent, things like that, when those are things that can eliminate that choice that families have to make about whether our children are fed or not, that's a go. That's a hard go. I mean, we have to protect our children. So I'm excited that we're having these conversations and we've had the opportunity to try things a different way in removing some of those rules because they're working out really well for our children and our families.
Mm-hmm.
Wow, Stacy, that was really well said. I'm going to tell you all, I can't help but be optimistic with conversations like this because of your organizations and your work individually of creating these partnerships. And these are partnerships that, again, you mentioned this, there are a lot of these partnerships predated COVID, but I have seen this expansion of networks that have really come together in this space to say, we're going to do all we can to your point, Chris, hey, federal programs, we are going to absolutely utilize this for the best for all Oklahomans. State program, we are all nonprofits, state entities, we're all going to work together to really jumpstart an effort to ensure Oklahomans are getting these resources during a global pandemic. And so I think that, again, because of the work of you all, and I can't tell you enough how much I appreciate this conversation today. I think the three of you guys are fantastic, and I appreciate you all sharing with us all the work that's being done for Oklahoma students and Oklahoma's young people, but also things that need to continue. And you've given us a lot to think about here about the future and what we need to continue doing to ensure that Oklahoma addresses this problem in an effective way. I wanted to thank everyone for joining us. The audience out there, thank you for listening to this conversation on an issue that's very, very important and impactful for our young people. I also want to encourage everyone to follow Echo on social media at Every Kid Counts OK. And I wanted to encourage you all, this conversation, if you want to know more about food insecurity, ways to help your community, these programs we've talked about today, please visit tset.ok.gov. Also, Regional Food Bank, all one word, regionalfoodbank.org. And also Hunger Free OK, all one word, hungerfreeok.org. Great places to go for you to learn more about those resources and the programs that we discussed today and get in touch with our panelists here. So again, thank you to all of our panelists. Thank you, audience, for joining us today. Hope you all have a great rest of the day.
Thank you.